Welcome to the COVID-19 vaccination clinic. Today you'll be receiving the AstraZeneca COVID vaccine, which is currently the preferred vaccine for those over the age of 60, and it is also available for those over the age of 18 with informed consent. As the situation with the COVID vaccines and the COVID landscape changes, the information about the COVID vaccines will sometimes change, and therefore check with your vaccine provider about the most up-to-date information. Current data suggests that the AstraZeneca vaccine has an efficacy of about 70 to 80% for protecting against symptomatic COVID-19 infection, and it has a 95 to 100% efficacy in protecting against death and severe disease that requires hospitalisation. Currently, the recommendation is for the second vaccine for AstraZeneca to be given at the 12-week mark after the first vaccine. In places like Sydney, where there are currently a lot of COVID cases, the second vaccine has been moved forward to 6 to 8 weeks. However, this also reduces the efficacy down from about 80% down to about 50 to 55%. So in regional areas where there aren't very many cases of COVID, we would prefer to keep the second vaccine at the recommended 12-week mark. The vaccine is given in the upper arm, like with any vaccine, so in this region here. So please take off your jacket or your jumper in preparation for your vaccine today. Now let's talk about side effects. About up to 50% of people can develop some sort of side effect. Now this may be mild or it may be severe. You cannot develop symptoms such as a cough or a sore throat or a runny nose because it is not a live vaccine. However, your body does think it is fighting something. So it is very common to develop symptoms such as fever, chills, headache, tiredness, lethargy, muscle aches and pains, joint pains, sometimes a sore arm or swelling or redness around the injection site itself. And in rare cases, you may get enlarged lymph glands. So for this reason, it's recommended that women do not have a mammogram for 6 weeks after your vaccination. The TGA would like to know about all side effects, so please do report any side effects that you may have to either their website or the phone number that is listed. Now, with any vaccine, it is possible to develop an allergic reaction or an anaphylactic reaction. This tends to be very rare. However, for this reason, we ask that you remain 15 minutes for observation after your vaccination. If you have had an acute allergy to a vaccine in the past, then we will ask you to wait for about 30 minutes after your vaccine. Now, many people have been asking about blood clots. There is a condition linked to the AstraZeneca vaccine, which is a fairly rare condition, called TTS, or thrombosis with thrombocytopenia. This condition is where a blood clot forms, so thrombosis, in association with low platelets, known as thrombocytopenia. This particular condition is not related to the normal blood clots that people get, so it is a different mechanism to when people get either a deep vein thrombosis, a DVT, or pulmonary embolus, a PE. So therefore, people who have had these conditions in the past, or people who have other autoimmune conditions, or people who have other significant health conditions are not precluded from having the AstraZeneca vaccine. There are really only 4 main conditions that preclude someone from having the AstraZeneca vaccine, and these are all pretty rare. One of them is anaphylaxis to a previous AstraZeneca vaccine. Another condition is having had a previous blood clot on the brain or in the abdomen. So these are known as cerebral venous sinus thrombosis and splanchnic vein thrombosis. Another reason is a condition called heparin-induced thrombocytopenia. And the last condition is if you have had antiphospholipid syndrome with thrombosis. If you have had any of these conditions in the past, then please speak to your vaccine provider because you cannot have AstraZeneca vaccine. Now that we know the blood clots are an immune-mediated response, we know also how to treat them. So when we first discovered these blood clots, probably about 50% of people died as a complication of these blood clots. However, the outcome is now pretty good with only 6% of people having a complication. And so your risk of dying from this particular vaccine is in the order of about 1 in a million. If you compare this to your risk of dying from COVID infection, in Australia currently we have had about 40,000 cases of COVID. Of these, about 967 people have died. So if you break that down, that's approximately 2 people have died per 100 people who have contracted COVID-19. The condition of clots associated with the AstraZeneca vaccine typically occurs between day 4 and day 28 following the vaccination. Therefore, it is really important that you seek medical attention if you develop any of the following symptoms. In particular, severe or persistent headache that starts more than 4 days after your vaccination, because it is common to get headache as part of the side effects straight after the vaccination, and that is completely normal. However, if you get a new onset severe headache, in particular if it's worse with lying down, or you develop associated nausea or vomiting, then seek medical attention. Likewise, if you develop neurological symptoms such as blurring of vision, confusion, drowsiness, seizures, difficulty speaking, or if you develop chest pain, shortness of breath, leg swelling, or you develop tiny blood spots under the skin away from the vaccination site, again, please contact your GP immediately, or if it's after hours, please go to the emergency department for assessment. As we said before, the vaccine is 80 to 90% effective against developing symptomatic infection for COVID. However, that means that there is still a small chance that in the future you may still catch COVID or pass it on to someone despite having been vaccinated. However, this risk is still very small. This, however, means that if you do develop symptoms such as a cough or a sore throat or shortness of breath or a fever, you still need to go and get a COVID test done. And please also follow your local health authorities' guidelines in terms of self-isolation or stay-at-home orders, hand sanitising or social distancing. If you have any further questions about any of the vaccinations or the consequences of COVID, please speak to your GP or to your vaccination provider. Happy vaccinating!